Thank you so much for having me today. So I'm here, again, my name is Cecile Puretz, and I was the program manager consultant with Thriving in Place here in San Francisco, brought on to conduct a citywide needs assessment during COVID-19. So specifically to look at the technology barriers, gaps, and opportunities really experienced by people with disabilities, older adults, but also multiply marginalized communities. So communities that are really living at the intersections of aging, disability, low income, veterans, transition age youth. So I'll talk a little bit more about that, the details in a moment. So in essence, my presentation today will be to share really broad stroke overview of the core findings of this research that was conducted really over almost a 9 to 10 month period, but really the full needs assessment was over close to a year. And we published a report, which we will be sharing with you in a handout, as well as a summary of the key findings. We'll also be talking about the policy recommendations. So there's roughly 10 key findings and 10, 11 policy recommendations. I won't be going into a lot of depth, but the report will be able to sort of fill in the nuances and those gaps. Okay, so I'm going to go ahead and feel free to sort of jump in and post questions in the chat. Okay, so as I mentioned, Thriving in Place conducted this study, and I just wanted to start off by that this study really would not have been possible without the generous support of the Empowered Cities Grant Initiative. And the first phase of the grant initiative really went towards PPE to serving the disability and aging community in San Francisco, and phase two during COVID-19 really pivoted to look at issues of digital equity or inequality in San Francisco. We were part of a cohort of 5 or 6 other cities across the country. We were the only in San Francisco that really centered our work on digital equity. So that's really exciting. The Department of Disability and Aging Services, DOS, as well as the Mayor's Office on Disability, were core partners in really driving this work forward. I also wanted to acknowledge all of our community partners, as well as our advisory coalition. So this entire process was led and guided and informed by the work of 13 or about 14 community members, most of which were people with lived experience of disability. We had someone from the Veteran Justice Courts, residents of SROs, people experiencing homelessness. So it was really important. I won't spend too much time on sort of the methodology and community engagement, but I really want to sort of hone in on that point. That we really, in developing these programs and the needs assessment, it was really important to center in the experience of communities who are most impacted by these barriers in digital inequality. So here are kind of 3 of the sort of guiding questions that helped frame the needs assessment. The first, which I mentioned, were what are those technology barriers and unmet needs of San Francisco residents with disabilities, older adults, and multiply marginalized communities. We knew that we were building upon the research, the excellent research of the Digital Equity Strategic Plan conducted in 2019 under Alex Bond's leadership. So that really helped to sort of frame and to reveal some of the nuances that and challenges that came out of COVID-19. And then we did some more. It was really important to apply an equity, sort of an in-depth equity framework, is really thinking about the intersections between digital inequality and factors such as income, race, ethnicity, disability, age, language, housing, and veteran status. And then the last point is really sort of where we are now, is what are opportunities to really drive this work forward from an advocacy perspective, from a policy perspective, and to create targeted and strategic interventions. So I will also mention that the data set has been made completely public and open, and the real reason behind this is that we want to empower other community organizations and city agencies to dive even deeper into this because we collected so much data. So we used a multimodal survey. So we designed a survey a print-based survey that was distributed out in SROs, various community centers, places where people access services. So we had it in print, phone, digital format, Braille, American Sign Language. And so we collected a total of 3,080 over about 2.5-month period. We had to narrow down that survey pool to confirmed San Francisco residents, which brought us roughly to 1,529. And then I just mentioned sort of the anchoring in community-driven and inclusive participatory research. So another exciting piece of news and sort of the next steps of this project is that this project is now sort of the phase 3 community living campaign. Marie Jobling mentioned earlier the opportunity to launch a fourth, to use this data and research and momentum to really sort of build this Keep Us Connected campaign, pandemic edition, where we're presenting these findings and recommendations to community forums on the mayoral level, on the community level, and then to build this regional network of advocacy. So now let's dive into the demographics. So as I mentioned, we have a pool of about 1,529. By age demographics, we saw a slight majority of respondents were older adults, so 55%. We did a lot of outreach to TAY, transition age youth with disabilities, and we saw about 9%. And then when we broke down the demographics by disability, we saw a wide range of disabilities represented and reported in the survey. And this is really important to point out just in terms of building these, sort of adding to the baseline of the Mayor's Office and Disability and DOS and how we're documenting and reporting disability in the city. By race ethnicity, I wanted to spend a moment here because we actually, when we started this research, we really wanted to have a really diverse cross-section and representative sample. So we saw about 70% of survey respondents identified as Black, Indigenous, people of color. So below this bullet point, you'll see a breakdown, and I'll share this slide after, where we see 38% identified as Asian descent. 16% as white, Caucasian. And then right beneath that, 14% American Indian, Native American, Alaska Native, followed by Latinx and Black or African American. So I really also just wanted to encourage, part of our research was not discounting smaller percentages, but every person really mattered. And I think it's important to not leave smaller percentage out in a framing of thinking about inclusive research. Income, we had about most survey respondents, 33% had less than $20,000. And then by language, we saw a lot of diversity here as well. English, 49%, followed by Cantonese, American Sign Language, Spanish, and Mandarin. And then by housing residents, about 88%, we could further slice this data. We had a variety of housing situations, from rentals, affordable housing, living with friends or family, and then about 5% were experiencing homelessness. So people living in navigation centers, overnight shelters, or unhoused. And then about 23% are veterans. In terms of housing, this is also showing the breadth and reach of our research from the different supervisorial districts in San Francisco that we reached, from Visitation Valley to Chinatown, Mission, Western Addition. So again, these numbers are important markers of communities that need to be heard and seen. So now jumping into our key findings. So again, there's about 10 of these. So the first was, and again, I'll mention that this was a mixed methodology. So sort of sprinkled within the presentation, I'm including some quotes so that we can sort of fill in sort of the larger narrative around this data. So access to technology was a vital resource and presented key challenging in receiving services, information, and maintaining social connections. So this first point, so although the survey data indicated little need for devices or internet, so we actually found that 14% of the total survey population reported that they had no access to device, and 10% had no access to internet. When we asked the question, is technology a barrier in accessing services, 64% replied yes. So what this is telling us is that access to devices or internet is not enough. And so when we sort of further dig into that data, when we asked survey respondents, how do you access the internet? Here we see that 35% access through broadband internet, so paid membership plan, public Wi-Fi followed behind that at 24%, and then smartphone internet data plan, discounted internet, and free internet. And the reason why I really wanted to break down this data in this way is to even look at the free public Wi-Fi hotspot, right? 24%. So even though somebody says they have internet, that is not necessarily equating to high-speed, reliable, consistent access to internet. And then the top reported service needs during COVID that people experiences challenge accessing were health, food, housing, COVID information, and computer literacy. So computer literacy did figure within the top 5 needs. Second key finding, and this is really mirroring some of the digital equity strategic plan that we saw in 2019, where we found that affordability, unreliability, and concerns around online security were reported to be primary barriers. So here we have a breakdown of 5 points, the 5 top barriers. Cost of high-speed internet, cost of device, insufficient smartphone, and then last point, concerns around online security. This fourth point, during the pandemic, receiving medical services through telehealth was both vital and presented some key challenges. So when we asked people whether they used telehealth or they received services or mental health through telehealth, 67% reported yes. However, when we asked about their barriers, people responded, number one was the affordability of their device and training on how to use telehealth. And then 57% of respondents reported missing important medical appointments. And this is regardless of whether they access telehealth or not. And that is a really significant and acute issue. So when we did further slicing into sort of the question of telehealth to sort of reveal, well, who was really experiencing these barriers, we found that older adults, low-income households, and Black, Indigenous people of color, so specifically African-American, Latinx, and Pacific Islander communities voiced either in focus groups or in the survey that they experienced particular barriers. And then when we also, the data revealed that Latinx communities, so out of a pool of, I think, 110 people that responded, Spanish-speaking individuals that responded that question, we actually had a higher percentage, I think it was about 56% that reported not. So when we get to the recommendations, you'll see sort of how these findings will inform our recommendations. So next finding was around assistive technology. So providing free or low-cost assistive technology and AT training is vital to ensuring digital equity for residents with disabilities and older adults. So the top reported needs were the need for low-cost assistive technology, training on how to use that and what options are available. And then the last one is access to free or low cost repairs. So again, when we did more slicing, we did see, and by slicing, I'm sorry, I'm throwing out that word. What I mean is that we did sort of a more in-depth analysis where we were intersecting data points around demographics with the data findings. We did find that the need for assistive technology is greater for people with disabilities who are 60 and over. People experiencing chronic pain, mental health disability, Black, Latinx, Asian American, and Pacific Islander, and monolingual Spanish Cantonese. So I just wanted to quickly share this quote on the assistive technology. sort of finding. So here is a focus group participant living in an overnight shelter. I'm a low vision user. The most important thing for me is having a low vision keyboard. You know, they have big buttons for people with low vision, for people with disabilities and senior. I have a portable one, but if there are stations put up across the city, that would be very familiar. And then this second quote, I was never familiar with the term assistive technology until I joined this focus group. I see how vast it is because it's stuff I would never link to disability or disabled or assistive tools. So now I'm more familiar with it. I've always used these items. So moving on to public computer labs. So we all know that with the advent of COVID-19, it put enormous stress on people who were relying on public computer labs, such as the public library or computer tech hubs, to accessing free internet in a safe place. So we found that labs like this were important sources of internet for the disability community prior to COVID-19. So particularly, we found that 67% of transition age youth reported using computer labs. 82% of people living in assisted living or care homes or people experiencing homelessness, and then 82% of veterans. So again, these are really high numbers and really, again, when we get to our recommendations, I think will be a great way to link. So I'm actually going to sort of skip over this quote just in the interest of time. And then moving into customized digital literacy services. Digital literacy did appear within the top 5 needed resources during the pandemic. Lack of language access was cited throughout focus groups and in the survey, specifically by people who speak either Cantonese, Samoan, or Spanish. People with a history of chronic homelessness or who involved in the justice system had incredible hardships using technology for even showing up to a court date or booking a shelter bed if you don't have know how to use a device or internet. And then the lack of accessibility in the digital literacy training opportunities. So really folks wanting more opportunities to make accessibility, build in accessibility to all digital literacy trainings. So that concludes the key findings. Thank you for bearing with me. Andrew, should I just kind of roll right into our policy recs and then we can wait at the end and open it up for questions or reflections?
Yeah, we have one reflection from Dave Williams. Yeah, so I don't know if you're able to read it, but he's just commented it's very concerning about aging communities being vulnerable to aggressive, questionable promotional strategies used by insurance companies to lure, trick new consumers, especially during open enrollment. So, I maybe it's not necessarily technology related, but I think there are some concerns just about the vulnerability of populations and kind of technology access, etc. So.
Yeah, well, thank you for that question. I could just briefly answer sort of anecdotally when we were in focus groups, specifically with veterans and residents of SROs or people experiencing homelessness. One theme kept coming up is the distrust of San Francisco public Wi-Fi, or not specifically San Francisco, but the distrust of public Wi-Fi. And when one is making a booking an appointment or, joining, say, an AA support group or any of these sort of sensitive legal and personal matters, that really there was concern around how do we make public Wi-Fi more safe, more accessible in different parts of the city so that people feel safe using it.
Definitely.
Okay. Sorry, I don't see the chat box right now, but
okay, no,
me if you see any other questions.
Yeah, I think going into the recommendations, I think we can get back to Jennifer's question at that point. But.
Yeah, well, thank you, David. Okay, so now into our policy recommendations. So really, the purpose of these policy recommendations is to really drive forward you know, disability forward policies in our community. And, you know, I think Marie mentioned it earlier, is sort of how do we move to sort of more permanent, more sustainable solutions. Okay, sorry. Okay. So the first one is really, I think we can all agree, is really prioritize improving free or low-cost digital connectivity for residents with disabilities and older adults. There's been long standing conversations around developing sort of this free, high-speed public infrastructure across San Francisco, sort of, you know, and I'm not sure where we're at with that, but in the short term, here are some sort of ways that we were thinking is really expanding and increasing fiber to housing pipelines, having systems for device distribution. And then also one thing that came up also is creating publicly accessible charging stations, and really doing sort of a complete sort of audit of our public Wi-Fi in San Francisco. Is it working for people? And how do we really sort of prioritize bringing more access? The second point is around developing outreach channels to build awareness around the existing digital inclusion programs, including free or low-cost internet, devices, assistive technology, and skills training. And this ties back to Valerie's point really around you know, the need for, or that there is an existing centralized hub where people can access services. However, a lot of folks in our community are not aware of that hub. So how do we really sort of prioritize developing and refining those outreach channels in partnership with trusted community partners? The third one, related to assistive technology, is to develop pipelines to increase funding and the distribution of free or low-cost assistive technology. So San Francisco currently has a number of organizations, including the Independent Living Resource Center of San Francisco, Lighthouse for the Blind, DACARA, the Deaf Counseling Agency and Referral Agency, that works to increase sort of free or low-cost assistive technology, but there definitely there's a lot of room for growth. So I think that this is a key priority in increasing digital equity. Another point is thinking really broadly and holistically around launching a citywide digital accessibility program aimed at ensuring that virtual events, information, and services are fully accessible for people with disabilities. And so one example of this is the Senior and Disability Action led a campaign this year around really encouraging the city and other organizations to make remote access a permanent option beyond COVID-19, but also providing a tangible framework for improving the delivery of accessible information and communication technology. So one way that could also be realized is perhaps there are small grants that could be awarded to organizations to help ensure that their events are accessible. And by accessible, that can mean many things, but one example would be to provide ASL interpreters, or to provide live captioning. So those are some examples there. As I mentioned in the key findings, transition age youth with disabilities, I listed 18 to 26 here, it's typically 18 to 24, really was a key point and theme that kept coming up. So specifically, youth experiencing chronic homelessness or who are in the foster care system do not have enough employment, or that technology presented barriers, or lack of technology presented barriers to employment and to education. So repeatedly we heard that either youth had difficulty getting on Zoom, even with the support of a teacher, maybe their Wi-Fi wasn't working, or how to navigate medical appointments, or how to navigate. So really investing in programs that are targeted towards TAY youth. And then again, talking about employment opportunities, we did find that there were, this is again connected to transition age youth, is creating employment opportunities, such as, for example, a digital navigators program where people from impacted communities could be empowered and paid to help serve as navigators, ambassadors, to help disseminate resources within their communities. Telehealth. So piloting initiatives aimed at lowering barriers to telehealth. I know that Independent Living Resource Center has been doing some great work building pilot programs, but also thinking about equipping residents who are living in supportive or permanently supportive housing with those tools and digital literacy skills. And then this last point is the age and disability friendly, what Valerie mentioned, was developing a formal working group to support the implementation of these recommendations. And I really want to sort of bring it back to the idea that any sort of digital equity program or policy really needs to center the leadership of people with disabilities and older adults. And so I mentioned digital literacy here again. Focusing specifically, what we heard were some key barriers were language access, accessibility, and cultural relevance. So making sure that digital literacy trainings are informed by the communities who they're serving. Okay, so that concludes this very large presentation. Thank you for bearing with me.